Alright guys, I know I'm really late. I have to apologize. This week has been absolutely crazy for me at the hospital and some of the needs that some of the patients have had down there. So I spent most of my week down there, but I want to chime in before the midterm. I looked last night. Most of you haven't taken the midterm yet. So I do want to chime in. Hopefully this will guide your study a little bit as you prepare to take the midterm tonight. Remember that iLearn does shut down early tonight, so don't wait till the very last minute to take the midterm. The midterm is all about anatomy, making sure you understand anatomical terms, and I've tried to stress that in all of my lectures and the guidance I've given you, so make sure you understand anatomy and pay particular attention to the anatomy of the urinary system, which should be good for you guys because you just got done with that system. After that, it's all about prefixes and suffixes, how you add those to anatomical terms and to root words to make those say certain things or do certain things. If you understand how those combine together, you're going to do awesome on the midterm. It won't be a problem for you at all. The midterm is different from the quizzes in the fact that it's a more multiple choice. They're going to ask you what term below means this. And the practice quiz that I handed out a couple weeks ago should help you with that as well. So make sure you're utilizing the terminology builder and making words. So here are some examples. The suffix of plasty, that means surgical repair. So rhinoplasty, pyeloplasty, arthroplasty, blepharoplasty. These are all words that mean surgical repair. Surgical repair of the nose, surgical repair of the kidneys, surgical repair of the joint. Surgical repair of the upper eyelid is the blepharoplasty. So make sure you're understanding how to combine these, right? These are our root words, anatomic terms with the suffix of plasty. I don't know. Likewise, here's hypo, right? So this means a reduced amount of, like hypokalemia, reduced amount of potassium, hyponatremia, sodium. Hypohidrosis is reduced amount of sweating. Hypothyroid, reduced amount of your thyroid hormone. So again, this is about combining forms together, combining words and prefixes and suffixes together and understanding what those mean. Here we go again. Litho, right? This has been in, I think, 2 sections now. This means stones. So cholelithiasis. This is gallstones, nephrolithiasis, kidney stones, and erythrolithiasis. This is stones in the ureter, right? So here's different anatomic terms: chole, nephro, ureto. These are telling you where the stone is at. It's condition of stones, right? Lithiasis. So make sure you're paying attention, you're understanding that. And then raphe, this is suture of, right? So myorrhaphy, cystography, herniorrhaphy, right? Suture of muscle, suture of kidney, suture of a hernia, right? So make sure you're understanding those terms. Again, the suffix is rhea. So we have diarrhea, pyorrhea, gonorrhea. These are discharge, these are flow of something, right? So this is what the whole midterm is going to be like. They're going to give you words like this. They're going to give you a question that says something like, what term below means the flow of infection or the flow of pus, right? Is it diarrhea? Is it pyorrhea? Is it gonorrhea? Well, it's pyorrhea. Pyo means pus or purulent drainage. Rhea means the flow of, so the term is going to be pyorrhea. That's what the midterm is going to be like. So there we go. Ectasis, right? Dilation, bronchioectasis, ureteroectasis. So when it comes to this, they're going to say the term below, which term below means dilation of your ureter, right? Or which term below means dilation of the bronchus, right? And then you've got to go through the multiple choice words and find the correct word. That's what the whole midterm is going to be like. Anemia, right? This is a condition in the blood, hyperemia, extra blood flow, bacteremia, azotemia, anemia, right? So the sample question is going to be what medical term below means a condition of bacteria in the bloodstream, right? And they're going to give you these words, and then you got to pick. So that's going to be bacteremia, right? This bacteria, emia, means a condition in the blood. This is bacteria in your blood, right? Here we go. Another word, suffix tomy, right? Incision. Tracheotomy, meatomy, colostomy, craniotomy. So again, they're going to give you a question. Which medical term below means incision of an opening? And that's going to be right here. This should have been learned from this last section we were in. Okay, again, oligo, right? It means scanty, right? So they're going to give you a question. What term below means scanty amount of X? You're going to have to know that oligo means scanty and then know the anatomic term as well. Right? So there's many, many more, but the key is understanding how to make medical terms. If you understand that these are combinations of root words, prefixes, and suffixes, if you've been using your translation tables, if you've been using flashcards, if you've been learning how to put words together and not just memorizing terms, you're going to do very, very well on this quiz. You're going to be able to understand what words and the parts and put them together and identify the right word. It won't be a problem for you. If you're just trying to memorize terms, it's going to be a little bit tougher for you. So I hope that gives you some focus for your study for the next 24 hours or less than 24 hours as you take the midterm. If you have any questions, feel free to email me, call me, text me. Again, sorry for the lateness of this. I wish my week had been different for you guys, but it hasn't. So thank you.